The Ontario government said it was eliminating tuition fees along with post-secondary education requirements for new police officers, all in an effort to boost recruitment. And while this was applauded by some, including the police unions and various police services, critics say the province is also in dire need of more nurses, mental health, and social workers. So for more on this, I'm joined by Dr. Naheed Dosani. He's a palliative care physician and a health justice advocate. Dr. Dosani, thanks so much for your time this afternoon. You are questioning the priorities of the Ford government with this announcement. Explain to us why.
Yeah, I think it's best to frame this conversation as one that's really about priorities. Are we really looking towards a society where we're prioritizing community and healing, or are we prioritizing conflict and enforcement? And yesterday's announcement really seeks to really fund more so a reactionary approach to crime and society's ailments. What has got so many people upset about the announcement is that many people are saying we should be going upstream to address the social determinants of health, to support housing, to support mental health, to support harm reduction, to build better programming and services so people don't fall into a life of crime downstream later on. Ultimately, it's a question of priorities.
The announcement was framed by the Ford government as a response to lower enrollment among would-be police officers, trying to target people with different life experiences from different walks of life. Are we seeing similar issues across the health community as well?
Yeah, absolutely. I mean, the COVID-19 pandemic really showcased the major stresses that our health system is facing. I'm thinking of my nursing colleagues today who are facing significant burnout, moral injury, and compassion fatigue. We have a nursing shortage in this province. Nurses have been facing wage suppression for far too long due to Bill 124. I'm also thinking about my colleagues working in shelters who are helping to support a homelessness crisis. Over 10,000 on the streets in shelters just in the city of Toronto, let alone the rest of the province. And, as you reported earlier, the city of Toronto, a council at the city of Toronto is looking to declare homelessness an emergency here in the city of Toronto. Also, province-wide, we have 2,500 Ontarians who died of an opioid overdose death just this past year. And so there are many areas when you think about where these resources could have really gone and should be going to be able to heal our communities. We will never be able to police our way back to good health in our communities. We need to invest in our communities.
We learned yesterday this was going to cost roughly $34 million annually to pay for these $15,000 for these new recruits to go to Ontario Police College for 12 weeks. I know you've been doing just a lot of advocacy in general on this issue and, the greater picture of health in our province. Have you, Dr. Dosani, spoken to the Premier or know anyone who's had these discussions with the Premier in the last little while?
I think that what you're hearing from me is actually what you're hearing from many people who work in healthcare, social care, and mental health care. The idea that what we want to see, if these announcements are going to happen, we also want to see announcements that invest in healthcare and social care. There are good examples of when this government has done, this very thing in 2021, announcing funding to support training for PSWs in communities. So, I think there are many ways and steps that can be taken to create a more positive solution. Ultimately, investing more in policing, conflict, and enforcement is not what's going to heal and support and cure the social ailments in our communities. We need to go upstream, and we need to really work in our communities and serve our communities.
Dr. Naheed Dosani, always appreciate your time and your perspective. Thanks so much.
Thanks a lot. Have a good one.
You as well.